1. Which instructional strategy best supports surgical technology learners who require repeated hands-on practice to achieve psychomotor mastery? A. Lecture-based theory review. B. Simulation with deliberate practice cycles. C. Written peer review assessments. D. Independent textbook reading. 2. During a surgical technology course evaluation, which metric most accurately measures learner competence? A. Student satisfaction rate. B. Number of hours spent studying. C. Performance on skills-based checkoffs. D. Faculty teaching style preference. 3. When designing curriculum for sterile technique instruction, which action ensures alignment with NBSTSA professional standards? A. Adding topics based on student interests. B. Following trending educational videos. C. Mapping content directly to exam blueprint domains. D. Reducing competencies to shorten class time. 4. Which communication technique is most effective when mentoring a novice during sterile field setup? A. Speaking rapidly to keep pace with the procedure. Allowing the learner to guess each step independently. C. Giving timely, specific, behavior-focused feedback. Using only written reminders for improvement. 5. A preceptor notices a learner repeatedly contaminating the Mayo stand. Which evaluation action is most appropriate? A. Immediately failing the learner without explanation. B. Giving vague written comments about poor technique. C. Demonstrating proper technique and observing repeat performance. D. Ignoring the error to reduce learner anxiety. 6. Which regulatory requirement most directly affects surgical technologists in maintaining ongoing certification? A. Filing annual tax declarations. B. Completing continuing education hours. C. Attending employer-sponsored social events. D. Renewing residency documentation yearly. 7. Which learning objective best reflects a measurable outcome aligned with NBSA exam expectations? A. Understand surgical instrumentation. Become better at anatomy. C. Demonstrate identification of common surgical instruments with 95% accuracy. D. Know a lot about sterile processing. 8. During orientation, a mentor uses questioning to guide a learner to think through instrument counts. Which adult learning principle is applied? A. Learners resist problem solving. B. Learning should rely on passive listening. C. Adults learn best when building on prior experience. D. Adults learn best through memorization only. 9. A surgical technology instructor wants to enhance retention of aseptic principles. Which technique supports long-term learning? A. One long lecture with no practice. B. Distributed practice and spaced repetition. C. Giving a single large exam at the end. D. Allowing random guessing during skills lab. 10. Which factor is most critical to comply with ethical communication standards in the operating room? A. Avoiding questions to show confidence. B. Using clear, respectful, concise communication. C. Whispering to avoid disrupting the surgeon. Speaking only when spoken to. 11. When mentoring a learner in suturing, which behavior demonstrates effective scaffolding? A. Completing all steps for the student. B. Allowing the student to work without supervision. C. Gradually reducing support as learner competence improves. D. Criticizing mistakes after the procedure only. 12. During curriculum development, which step ensures content validity? A. Copying from unrelated medical textbooks. B. Aligning objectives, instruction, and assessments. C. Removing complex concepts to simplify grading. D. Leaving learning outcomes undefined. 13. Which evaluation tool is best for assessing critical thinking skills in surgical technology students? A. True-false quizzes. Matching terms tests. C. Scenario-based evaluations and case questions. D. Attendance logs. 14. A novice surgical technologist struggles to anticipate surgeon needs. Which mentoring strategy is most effective? A. Describing each step during surgery and prompting anticipation. B. Letting the learner observe silently for weeks. C. Having the learner read the policy manual only. Requiring the learner to memorize all procedures without discussion. 15. Which regulatory principle governs proper handling of patient information in the operating room? A. Freedom of Information Act. B. HIPAA confidentiality compliance. C. Public record access laws. D. Open workplace disclosure requirements. 16. When designing assessments for instrumentation knowledge, which approach improves reliability? A. Changing grading methods each week. B. Using consistent scoring rubrics and criteria. C. Allowing instructors to score based on personal preference. D. Eliminating objective grading tools. 17. Which communication method best promotes teamwork during surgical emergencies? A. Using assertive closed-loop communication. B. Remaining silent until asked to speak. C. Speaking casually without confirming orders. D. Avoiding eye contact to reduce stress. 18. A student expresses anxiety about passing the NBSTSA exam. Which teaching approach supports adult learner motivation? Minimizing concerns and ignoring emotional needs. B. Providing structured study plans and self-efficacy support. C. Telling the student not to worry and offering no guidance. D. Recommending they delay studying until the last week. 19. Which instructional method best reinforces safe handling of sharps? A. Verbal explanation only. B. Demonstration followed by supervised return demonstration. C. Independent reading assignments. Watching unrelated safety videos. 20. When revising a surgical technology curriculum, which step ensures relevance to current practice? A. Updating content based on current surgical guidelines. Reusing outdated lesson plans. C. Removing content to shorten training time. D. Allowing only student opinions to guide revisions. 21. While evaluating gowning technique, which feedback method is most effective? A. Immediate corrective coaching during the skill. B. Written feedback provided weeks later. C. Public criticism in front of peers. D. Allowing errors to accumulate before addressing them. 22. Which factor best reflects a high-quality adult learning environment? A. Instructor-dominated discussion. B. Opportunities for learner autonomy and self-direction. C. Prohibiting questions during instruction. Memorization-only strategies. 23. In a high-stakes skills assessment, which principle supports fairness? A. Using inconsistent testing environments. B. Providing clear criteria before evaluation. C. Allowing untrained evaluators to score performance. D. Assessing different skills for each student. 24. A learner incorrectly applies a tourniquet during skills lab. What is the best mentoring action? A. Correct the learner, explain the rationale, and supervise retry. B. Remove the learner from the lab. C. Ignore the error to maintain confidence. D. Criticize the learner harshly for the mistake. 25. Which term describes a curriculum that progresses from basic to advanced surgical skills? A. Linear redundancy model. B. Scaffolding progression model. C. Spiral content reduction. D. Disorganized modular sequencing. 26. Which communication technique best prevents errors during sponge counts? A. Assumed agreement. Nonverbal gestures only. C. Verbal confirmation with mutual verification. D. Rushed counting to save time. During an NBSTSA exam review session, which strategy enhances exam readiness? A. Practicing recall with timed simulation questions. B. Focusing only on textbook summaries. C. Skipping practice questions to avoid stress. D. Studying without tracking progress. 28. Which regulatory rule governs proper sterilization documentation? A. Optional recording policies. Facility-specific gossip protocols. C. Mandatory tracking logs and monitoring requirements. D. Unsupervised personal note-taking. 29. When teaching surgical anatomy, which approach supports deeper learning? A. Rote memorization without context. B. Integrating anatomy with real case examples. C. Reading definitions only. D. Avoiding visuals. 30. A mentor wants to promote reflective learning in a student. Which method is most appropriate? A. Journaling after procedures and discussing insights. B. Ignoring learner questions. C. Forcing memorization-only tasks. D. Prohibiting self-evaluation. 31. For evaluating a student's sterile field management, which technique demonstrates authentic assessment? A. Written exam only. B. Realistic simulation of surgical setup. C. Attendance tracking. D. Self-grading only. 32. Which action is required to maintain compliance with infection control standards? A. Removing gloves to multitask. B. Performing hand hygiene before and after patient contact. C. Wearing jewelry during procedures. Reusing disposable items. 33. When preparing learners for interprofessional communication in the OR, which skill is most essential? Conflict avoidance. B. Clear information exchange and assertiveness. C. Passive listening only. D. Unquestioning obedience without clarification. 34. A student incorrectly loads a needle on a needle holder. Which feedback technique best promotes learning? A. Immediate correction with a demonstration. B. Written feedback given at the end of the semester. C. Allowing the error for later discussion. D. Criticizing the student in front of others. 35. When designing a surgical skills lab, which principle ensures high engagement? A. Passive observation. B. Opportunities for repetition and hands-on practice. C. Strict no-question policy. D. Only instructor demonstrations with no student practice.